Hi everyone, I'm Bianca.
And I'm Libby.
And we're swinging into OT.
Today's video is going to discuss all about what occupational therapy is and how it became a medical profession.
And no, it does not mean we're going to get you a job.
OT helps people throughout their lifespan do what we consider occupations. Now, there are 8 types of occupations. There's ADLs, or activities of daily living, which includes self-care, like washing your face, washing your body, brushing your teeth, all the things that you need to do in order to get ready for the day. The next one are what we consider IADLs, or instrumental activities of daily living, which would probably include home management, financial management, and yard management, things that, or taking care of a pet, taking care of another person. Then we also have education, we have work, we have play, we have social participation, rest and sleep, and lastly, leisure, which we've been engrossed in during this quarantine.
We use what is called a client occupational profile to get to know our clients' occupations, and we use what they enjoy and want to be able to do in our therapeutic sessions.
But before we get into all of that, let's talk about how OT became a healthcare profession.
Occupational therapy began during the years of World War I, specifically in 1917. Emphasis on occupation as the main focus of occupational therapy began in the 18th and 19th centuries during the morale treatment movement. This movement focused on the understanding that individuals with mental illness adapted poor habits of living and that they could increase their quality of life through the use of participation in everyday occupations.
The founders of OT believed that mental illnesses facilitated difficulty with adaptation, habit deterioration, and an imbalance of work and play. OT was recognized as the best tool for rehabilitation because it combines both the use of both mental and physical capacities for everyday life.
Herbert Hall was a physician in Massachusetts. He was the first to apply this paradigm. He actively engaged patients in arts and crafts activities as part of their treatment. This became known as the work-cure approach. This approach soon caught on in other areas, and the first publication on the use of occupations in rehab was created. Soon, other mental health facilities began to use this approach.
William Rush Dunton Jr., or the father of OT, was a psychiatrist at an asylum in Baltimore, Maryland. He adapted the work-cure approach further and began to teach classes to nurses, and then released his own book on occupational therapy. By 1910, an occupational therapy approach in therapy became increasingly popular, and more classes were being taught to other professions, especially at the new Chicago School of Civics and Philanthropy. The moral treatment movement was also put into effect in the settlement house movement, such as the Hull House. The Hull House was where those who lived in poverty in the urban areas of Chicago were able to learn practical skills for living and escaping poverty, and then also developing their own self-reliance.
To be an OT, it was expected that students would display certain personality traits and habits, which later became known as therapeutic use of self, aka 2Os. Therapists were expected to be sympathetic, tactful, inspirational, and creative with the understanding of psychology of everyday life. Therapists were also expected to adapt activities so that individuals could participate in meaningful activities.
One of the biggest turning points for occupational therapy was in World War I. The war created a desperate need for vocational training of wounded soldiers before returning back to civilian life. The focus of initial OT treatment for soldiers included bedside occupations, or occupations that would include woodworking. As their health improved, soldiers were able to participate in curative workshops using tools and machines. Once the soldier completed these steps, they were eligible for placement in vocational training.
Activity analysis, which is what OTs do to analyze each motion, procedure, and tools required for activities, was influenced by professions such as engineers. Specifically, Frederick Taylor, a mechanical engineer who popularized time and motion studies. OTs used the strategies to help soldiers returning from the war. Although the war was useful in promoting OT as a profession, there were still challenges OTs had to face to show that they belonged in the medical field.
OTs had to show the benefits that occupational therapy provided to individuals with chronic illnesses, as well as its vitality for a patient's recovery. Eventually, they moved away from the title of Women's Volunteer Auxiliary Group to something that was more defining. ELENOR, CLARKE, SLAGLE, Herbert Hall, William Dunton, and Thomas KIDNER conducted meetings to further develop occupational therapy's medical identity.
ELENOR Clark Slagle, also known as the mother of OT, put forth prescriptions to teach physicians about OT and differentiate this profession from other activity and vocational professions such as physical therapy. She also began the first program of occupational therapy, known as the Henry B. Favell School of Occupations, at the Hull House in Chicago, and served as the president and secretary of AOTA from 1919 to 1920. Hall and Dunton created ways that the profession could standardize its record-keeping system to facilitate acceptance by other medical professions and to demonstrate the effect of OT on clients. KIDNER, who was the president of AOTA from 1922 to 1928 and was an architect, used his influence to establish a place for OT in rehabilitation and tuberculosis care for post-war opportunities.
During the 1920s, people acquired chronic illnesses after the war. As much as OT's focus was on educating the client and engaging the client in functional movement and mobility, the role of occupational therapy shifted focus to adaptation, meaning that occupational wellness and independence was the main emphasis during this time.
During the Depression years of 1929 to 1939, treatment continued to emphasize OT treatment. However, after World War I, the consolidation of OT into the medical field was slow. By 1938, only 13% of hospitals approved by the American Medical Association had qualified OTs, and the majority of OTs were in mental hospitals.
By the end of the 1930s, the need for OT was on the rise again when the U.S. entered into World War II. In the span of 5 years, the number of OT schools increased from 5 to 18 schools. OT was also transferred to the reconditional division, which allowed therapists to assume new responsibilities and adopt new rehabilitation methods, which included goniometry, range of motion, and manual muscle testing.
In the 1930s, the AMA began to sponsor the profession on an organizational level, including accrediting OT schools in 1935. This connection with the AMA strongly tied OT to the healthcare industry. OTs were placed under the subjects of physical medicine and rehabilitation services. The decade after World War II was one of the major growth and solidifications of OT's role.
Because OT's background in rehabilitation was during and after the World Wars, occupational therapy tended to be a female-dominated profession. And standards for education had vastly changed with the growth of medical and technological advancements in the 20th and 21st centuries. Between 2014 and 2018, the percentage of male OTs in the US increased from 11% to 15%. The profession is still dominantly female, but this was a sharp increase for our male colleagues. Additionally, occupational therapy required a bachelor's degree until 2007, when it then became a master's level degree. Over the last few years, there's even been a push to require it to be a doctorate, but that's a whole nother topic. Now, there are more than 100 graduate schools in America that have been accredited master's programs of science in occupational therapy, and then some doctorate level courses.
Thanks for watching. If you like this video, give it a thumbs up, and don't forget to subscribe below. Also, if you have any ideas of other topics you want us to touch upon, please leave a comment down below.